Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to the very first show of the Doctalk show for the year 2020. We hope you've had a wonderful festive season and we're glad to have you back on the Doctalk show. So it gives me the utmost pleasure to wish you all a wonderful, happy new year. And of course, the new year, being a new year, it comes with new dreams. People have big ambitions, people have plans to get married, people have plans to have children. So in today's show on the Doctalk show, I want to talk about an issue that you might want to take seriously as you make plans, especially to have children. It's quite a sensitive issue and it regards fertility. If you have problems, you might experience problems getting children in the future, or if you're already married and you're struggling to have children, you may have been to this doctor or the other, this show is for you. We are discussing infertility, and with me in studio, I'm glad to host two expert gynecologists and infertility specialists who are going to take us through this very big topic. So on my immediate right is Dr. Chigundu Sfire from Henrob Hospital, and to his right is Dr. Sematimba Kato Steven. I got that right? Yes, so you're most welcome to the show, doctors, gentlemen.
Oh, it's our pleasure.
It's utmost pleasure to have the very first show of the year. And I'm your host for the evening, Dr. Darius Sote. So without wasting time, let us get to understand what is this infertility. Why is it that people, they have these plans to get children, they're happily married and all. 1, 2 years, 1 month, 2 months, 5 months, 10 months, the auntie's already asking where are the children, none is coming. So what's going on? What's this infertility issue? Maybe Dr. Chugund, you can start us off.
Infertility is a broad thing. It's a big challenge to the community. Most times it is unthought about. And generally, in the simple definition, I would say infertility is failure of the couple to conceive, or rather to get a pregnancy in a period of about a year of trying.
Within a year of trying.
And
it doesn't
trying,
matter how many times.
It means a couple having regular intercourse. That's about 3 times a week.
3 times a week?
And yes.
Okay.
And
so 3
they're
times
not
a week
using any form of family planning.
for 52 weeks. I don't know what maths is. That's like already in 500s. But so they have tried over 300
yes,
times.
It has to be regular, and there has to be no family planning. If they fail to conceive or get a baby or get a pregnancy in a space of 1 year, we get concerned. Okay. Though sometimes we bring down the duration to 6 months.
That's what I was going to ask. 1 year seems quite a lot of time. A very long time if you're having it 3 times a week. And then you have to wait a full year to say that you're infertile. But yes, so you're saying the cutoff around 6 months to 1 year. That's when people should get concerned that the
6 months is a bracket we use for women who are above 35, or women who have obvious factors like fibroids, they have polycystic ovary syndrome. If they have any sort of factors which will obviously prevent them from having a baby, we shorten the duration to 6 months. Okay. But generally, we wouldn't be much concerned if a couple haven't had a baby for a full year. But if you go up to 1 year without a baby, really we need to think.
And you've been at it for quite a while. So Dr. Sematimba, how big is this infertility problem? We hear a number of couples have this issue, they're trying to get kids, but we don't really know, is it becoming a common thing? Should people be really worried? Is it on the rise, like we hear of diabetes, strokes being on the rise? Is it the same for infertility?
We really don't have statistics in Uganda to bring out this problem. However, worldwide, it has been seen that infertility is in about, if you get 100 couples, about 10 to 15%, 10 to 15 of those couples will have issues.
In having. That's like 10 to 15%.
Exactly, 10 to 15% of the couples.
But that's on the global scale, not in
global
Uganda.
scale. However, as gynecologists who are attending to these patients, who have been attending to these patients, we have seen a gradual rise. The clinic grows, and you realize that actually most women come. Some of them have conceived before, but are failing to get the second, third, or so. Others actually don't have any, and we are forced to intervene as clinicians who were specialized in handling infertility.
Oh, so it means it can also happen even after having a child.
Exactly.
Then you fail to get children
exactly.
again. Okay, so I think most people think it's complete failure. You've tried, you have no child, and then they call it barrenness in women. I don't know what the equivalent is in men, but most people think it is a couple, they don't have children, they have completely failed to get children. It can work the other way around.
Exactly.
They get the first child,
Yes.
and then things
You can
fail.
even get the fourth child when you want the fifth,
Then
and you
it
fail.
refuses.
And these issues can affect both men and women.
Okay.
So should be taken as a couple, not as either a man or a woman. Yes.
Okay, so
So it can be, you can classify it for clarity as primary infertility or secondary infertility, where primary infertility is the couple fails to get a first child.
Right.
And secondary infertility is where they've had children, or one of the two has had a child or a pregnancy, but failed to get a second. But also, we should also note that infertility is not really only about getting babies. Okay. But if you cannot carry a pregnancy up to term, rather up to 28 weeks, that is what we call a period of viability, then we consider you as infertile. You must be able to carry a baby up to term. So if you're having recurrent pregnancy loss, you're getting pregnant, but you cannot carry pregnancies below 28 weeks, we still put you in the bracket of infertility.
So some
Then
scientists have tried
yes.
to say this is infertility, this is subfertility. So
okay.
subfertility is some people conceive, but they can't carry their babies.
It can't
they can't
reach
get a live baby.
the 9 months.
Exactly. So that is subfertility.
That is
and
the subfertility.
ultimately, you can't. What you want is a live baby. So sometimes the cause could be cross-cutting between infertility and subfertility.
Okay, but with this discussion, it sounds almost like the problem is on the lady who is failing to get the child. Is it so that it's always the ladies? It's a problem of the ladies, or it can also be a problem of the man?
Oh, thank you very much.
Because the factor the central factor here is the child. And you know, in the African thinking, a woman is supposed to deliver the child. So one can mistakenly confuse infertility for the woman's problem. Can you address that issue there?
Infertility is, we address it as an issue of a couple.
A couple.
Not an issue of a man or a woman. Because to have a baby, the man contributes and the woman contributes. So whatever goes wrong can go wrong in a man or can go wrong in a woman. So that's why I want to talk about a couple, not a man or a woman, or male or female. Maybe
in your medical practice, what stories have you had? You know, there are quite interesting stories around infertility. People say the lady's family was bewitched, the spirits of the ancestors are following them. Is that true, Mr. Dr. Chigund?
There's a lot of stigma surrounding fertility. Some of them don't come, others seek alternative medicine. And that is why you can't clearly pick them out and help them. But infertility, let's say, is both a social and a psychological problem. It really affects, it does. It affects families, it drains society, and it causes a lot of depression and mental issues, and we have to really think around it.
Yes, to address it at the root cause.
Yeah, exactly.
Okay, so more about infertility coming after the break. We shall discuss more of what could cause someone to fail to have children. Remember, infertility can affect both a man and a woman. It's not just a woman's problem. So for you who think infertility is a woman's issue, you have to think again, because as our doctors will explain, the factors are quite diverse and they can affect both sexes. So don't go away. We'll be right back after the break.
You are watching the Doctalk Show.